Well, there's growing calls for the federal government to do something more drastic about tackling mental health. The budget is just next week, the perfect time to allocate funding. High on the list of concerns is the impact of last year's cuts to the Medicare-subsidised psychology sessions, which some psychologists say are forcing patients to ration their mental health care. Joining me now is the president of the Australian Association of Psychologists, Sahra. Thanks so much for your time. You've got a long list of things for the budget to consider here in this space, but what's at the top of that list?
I think, as you were just saying there, we really need to have those additional sessions for all clients of psychologists reinstated across the country. And I think that we know that with the 20 sessions that we had during COVID, this was able to provide people with the correct number of sessions that they were able to actually use to have long-lasting improvements in their mental health. That reduction of sessions back down to the pre-COVID 10 sessions per calendar year has again forced people to ration their sessions, to space out their sessions, because they are not really able to afford to come at the frequency and regularity that they need for their treatment. Another thing that we at the Australian Association of Psychologists are arguing for, and we're hoping that the government listens to our pleas in this next budget, is the increasing of the Medicare rebate for psychology sessions across the board. Currently, it is unworkable for psychologists to bulk bill clients in a lot of cases, unfortunately, because a lot of psychologists are working in and running their own private practices. And so we need to have a sustainable rebate to make that affordable for all clients of all psychologists.
Okay, so if you had to put a figure on it, I'm sorry to put you on the spot here, but if you had to put a figure on it, how much is this sector underfunded by? In a perfect world, what amount of money would be required to actually make sure that every Australian had this mental health safety net? Not just psychologists, but counsellors, services available to them.
So at the moment, and I think this is a really great question to ask, there are so many aspects and factors of mental health care across Australia. And we know that currently the Medicare budgets for psychology sessions are woefully underfunded. To put a figure on that, we're looking at, tens of millions, if not hundreds of millions of dollars. We know that the government is able to fund these sorts of large projects. And we know that particularly with some of the more recent horrific situations that has put a lot of scrutiny on the mental health sector, that there needs to be large scale investment in the sector. So we need that rebate to be $150 per session for every client seeing a psychologist. We also need more investment in rural and regional areas. So we need to have incentives for psychologists to go to and stay in regional areas across Australia, because we know that these are the areas that are being underfunded. We know that there's not enough services in those rural and regional locations.
Well, let's see what's on the budget and then we'll talk soon. Thanks so much for your time.